Second housekeeping item, I invite you to submit your questions today. We have about an hour program. Please feel free to use the chat throughout the presentation, and we'll be sure to compile all the questions and then save the responses to the end. If we run a little short on time, then we will certainly circulate a written response to all of your questions, as well as a FAQ after today's presentation. And then the third is to ensure that we have time to hear from all of our Help Me Grow communities. We are going to be introducing each of our speakers in the chat along with their contact information, so please keep an eye on that. And I'd like to thank my colleague in Long Island, Risa, for making those introductions of our distinguished panelists today. So before we start our official program, I would like to welcome and introduce our Help Me Grow champions. We are delighted to have both Senator John Mannion and Assemblyman Andrew Hevesy join us today to kick us off for this fantastic program. Prior to this year's state enacted budget, Help Me Grow had not received any state level support. We are incredibly grateful to you both for carrying the Help Me Grow banner and for being such vocal champions and supporters of this impactful and valuable resource, Help Me Grow. So first, I'd like to introduce New York State Senator John Mannion of the 50th Senate District and Chairman of the Committee on Disability to share a few words. We are grateful for your support, Senator Mannion, and with that, I would welcome you to the floor.
Thank you, Rachel, and thank all of you out there who could have gone into a number of different professions, but you chose to do this, and I think we all agree that the rewards that come from it personally, you can't put a price tag on. But that being said, in New York State, we have to make sure that we're compensating organizations and individuals in an appropriate manner and treating everyone like the professionals that they are. You know, for those of you that are working with kids, and many of you are working directly with them, the parents appreciate it. Those victories, those milestones when they're reached is so rewarding and essential for the success of those kids and honestly those families. You don't just provide skill building and otherwise, you provide hope. And as a parent myself, I appreciate all that you do. But from a state level, we've got to do better on funding and reimbursement rates, because we all know that when we invest in each other at an early age, we reap the benefits of that, not just as individuals, but as a community, and dare I say, the state's bottom line as well. So thank you for having me here today, and I can't thank all of you enough for what you do. As a parent who has seen those victories, there aren't words to describe, is what I would say, and I'm great to see my Assemblyman colleague here, Assemblyman Hevesy, who is also a great champion of all of this, and is Disabilities Chair and a member of the Education Committee. I hope and believe that we'll be fighting together again in 2023. Thank you.
Senator Mannion, thank you so very much for those remarks, and again for being such a champion for Help Me Grow, and certainly connecting children to resources and supports in a timely way as we think about the investments we make in our most vulnerable. So thank you for that. Now, please let me introduce and welcome Assemblyman Andrew, I was going to call you Andy Hevesy, but I'll call you Assemblyman Andrew Hevesy. We'll have the formalities here. And certainly want to invite you to share a few words as the chairman of the Committee on Children and Families. We're grateful for your leadership and certainly your allyship for children and families across the state. So with that, I will offer you the floor. Thank you.
Rachel, thank you so much. And feel free to call me Andy. Sorry, I didn't change it in the chat. Andrew's when I get in trouble at home. So thank you to everybody who invited me here. Thank you to Senator Mannion, who is a great champion, not only on
in the chat,
but a number of issues. up in Albany. And I'd like to thank everybody at Help Me Grow for what you do. Let me offer just a general perspective on where I think New York State government is, and the amount of money that we got last year, and then where we go prospectively. So from my my limited perspective, over the last 10 years, New York State has been intentionally cutting money from kids and families. It's an unfortunate fact. The last governor put in place what he called the 2% cap on state spending. And that cap, by definition, meant that you're going to be cutting money from children and families, because the secret that we didn't tell you over the last 10 years is when you have a 2% cap and you automatically have healthcare and Medicaid growing at a 4% rate and education growing at a 4% rate every year automatically, those are the two biggest parts of the budget. By definition, if you're capped at 2, then something's got to be held at 0 or flat. So we are coming off a decade of disinvestment in every kind of program for kids: childcare, foster care assistance, kinship care, preventative services, everything you can think of. Plus, every year we in the legislature had to fight back proposals from the executive to eliminate some of the programs we know and rely on. However, last year, new governor, new time. So we were able, with Senator Mannion's help, and I also see someone from Assemblywoman Szilagyi is here, but in the legislature, we were able to put together the very big coalition of our colleagues, and the result was the largest single investment in children in the history of the state of New York. We were able to invest $7 billion over the next 4 years. I reversed it, in childcare. In childcare, we were able to raise the workforce salaries, and we were able to get money to expand eligibility for kids. But also tucked into that budget was something that you guys know about perfectly well, and I think is one of the best things we were able to do last year, and all portends, is that a good word, portend? Well, I'm using it anyway. Shows what the future will hold. So the $200,000, a tiny fraction of our budget, went to one of the first ever primary prevention programs in the history of the state of New York. And that is so significant, because that's the model that has to be invested in this year. And I'll tell you why. I am one of these people. I don't know if anybody else is on this call. When you look at the news and you look at the newspapers, you see terrible things happening. Well, I am of the opinion almost all of it is preventable, every bit of it. And government is just not designed to get in there and prevent problems the way we should. Even some of our prevention programs, forgive me, you can't get access to any prevention programs for kids and families who are struggling. We can't prevent ACEs and trauma unless somebody is involved with the child welfare system or the juvenile justice system. And that's not prevention. That is preventing worse problems, but these families are already in trouble. What Help Me Grow does, and what's so important, is the model that you have where you listen to the community. You don't come in and prescribe what has to be done in the community. You go and listen to the community, and you provide the resources and the families to actually prevent trauma, to prevent the things that are going to get these families into the child welfare system. That's the future of government. We're seeing it at the city level. New York City is also getting into the business of primary prevention. They're starting to expand their family enrichment centers. They have 3, they're expanding more. And New York State, we just had a hearing this week about primary prevention, and the OCFS commissioner has some very good ideas about it too. So I am incredibly excited, because this is a reshifting. I started with how bad the last 10 years are. Well, we woke up. There's new players in town, and we realized that to help kids and families, you got to get in there before there's trouble and before there's trauma. And that's why we think that Help Me Grow is the future. That's why we were so proud to get you that little bit of money, which is just a down payment on what we're going after this year, which will be much bigger and much more robust. So we're going to be building that coalition of elected officials with Senator Mannion and Assemblywoman Szilagyi and all of our partners, and we're going after more money for you, because this is the way that government should be structured to solve problems. So I just wanted to tell you all, we are incredibly grateful for the work you do. We believe in the work you do, and we're going to go fight to make sure that these programs are funded this upcoming budget year, and I am so honored. Rachel, thank you, and all of your colleagues for having me here today. Thank you very much.
Well, I'm just going to say amen. Yes, thank you so much for for those remarks and for fighting for us. Prevention is key. And yes, we are calling on our partners in government and our leaders in Albany to lean in even more for Help Me Grow and making sure that young children have the best possible start for the best possible future. So thank you, Assemblyman Hevesy. Thank you, Senator Mannion, for kicking us off for today's program, and for all of our other partners in government and policymakers that are a part of this presentation and today's call. We are grateful for your support and being such champions for Help Me Grow. And with that, I am going to turn us over to the official. What we are all really excited to hear is about those impacts, about the difference that Help Me Grow is making across the state and across communities from Long Island, Onondaga County, Monroe County, and the Finger Lakes, and Western New York. So I'm going to start us by inviting Dr. Isaacson to share a little bit about Help Me Grow from the national context, and then share more on what is happening in Long Island. And as we're sharing, that's going to cue me to share my screen so that we can see this presentation. And again, thank you all for being with us today. And we're really looking forward to sharing this awesome work with you all. And with that, let me get us started.
Hi, everyone. Good afternoon. I'm Liz Isaacson. Rachel only called me Dr. Isaacson when I'm in trouble. I'm kind of like Andrew and Andy there. And I have to say, Assemblymember Hevesy, the explanation of what you gave for Help Me Grow was like spot on. I feel like my job is just now like 10 times easier. So welcome everyone to our Lunch and Learn. So I don't know if you want to advance to the next slide, Rachel.
I do.
There we go. So, you know, here at Help Me Grow, across our 4 different systems. So, you know, Help Me Grow is a model, and you can implement it at a community level, and each of us define our community differently. So in Long Island, we define it as both Suffolk and Nassau. In Onondaga, they actually define it as Onondaga County. In Monroe, they define it as Monroe and the Finger Lakes. In Western New York, they define it as the counties of Western New York. So everyone can choose to sort of do it differently. And I think in being the 4th largest state in the country, we need that flexibility, right? In New York, you can't necessarily get one thing to work in Long Island and get it also to work in Onondaga County, but Help Me Grow has that flexibility. And that's why all of us from these different regions really think it's a wonderful model. And really, we think that a better future starts with Help Me Grow. And we believe that all children should be able to grow, develop, and thrive to reach their full potential. And there, you know, New York is a generous state. We have a lot of community resources, and a network of community resources works like a power grid. When the grid functions well, families can plug in to an organized flow of resources and easily access the ones they need when they need it. Unfortunately, sometimes the system's not well organized and they're not part of the grid. And it becomes very difficult for families to access those resources. And that brings in inefficiencies and missed opportunities, not getting families the resources when they need them in a timely manner. So Help Me Grow really exists to sometimes build the power grid for early childhood services that doesn't exist, sometimes strengthen an existing one, and sometimes, I got to mix my metaphors here, I'm going to move from power grid and say, sometimes we're the grease that make the gears move, right? To make things work together. Sorry for the mixed metaphor. But Help Me Grow has 4 main parts. Importantly, there's a centralized access point. This is where families can turn to get information and warm handoffs to resources. Importantly, Help Me Grow doesn't replace any existing community resources. We strengthen existing community resources. We do continuous outreach to family and our communities to find out what they need and adapt what we're offering to their needs. We do continuous outreach to the health community because, you know, I'm a pediatrician by training, so a little bit this could be biased, but few systems touch children under the age of 5, particularly under the age of 3, as much as the healthcare provider. You can have up to about 20 visits just for well care between birth and age 5 And certainly you have a lot of sick visits in there for any of you who have kids, right? A lot of ear infections and other visits. So it's a universal touch point, and that's why it gets its own gear. And lastly, an important part of Help Me Grow is data collection. Each of the communities and affiliates of New York State that implement Help Me Grow, Long Island, Onondaga, Finger Lakes, and Monroe, and Western New York, all 4 of us collect data continually, and we don't let it sit in a database. We use it constantly to see how we're doing, how we can improve systems. I'm not going to read that slide because you can read it. Oh, we lost my animation on this slide. All right, but I'm going to have to do it without being animated. So I want for a second, this is a complicated slide, but before we get to the complication, I want you all to close your eyes for a second and think of a baby you knew that came into your life, whether it's your own child, a niece, a nephew, the friend of a child, the child of a friend, and holding that baby for the first time. And then I want you to think about their 5th birthday, when they turned 5, ready to enter kindergarten, and then blowing out the candles. The bottom line of this graph are those 5 years. And think about the change, the tremendous change that happened in those years. No other period of life has that much change. And there's nothing like that image of the infant and then a raucous, rumpus, crazy 5-year-old birthday party with them blowing out the candles. All that happens, and that has such potential. And the people that lead the child through that are the parents and the families. And as Assemblymember Hevesy said, government needs to help them through that process, but they're the ones that are in charge. So my complicated graph. This was taken from actually the head of Help Me Grow, a guy named Dr. Dworkin out of University of Connecticut. And then he stole it from Dr. Halfan out of UCLA. I like to tell you, because we say something in early childhood, which is not necessarily a well-funded entity, that we steal shamelessly and share seamlessly. So I have stolen this slide shamelessly. You'll see the red trajectory. So this is really talking about healthy development on the y-axis and age on the x-axis. And you'll see delayed development. There are children that are unfortunately have inherent delays. Perhaps they're born with a genetic disorder. Perhaps there was an incident at birth that may have caused some issues, and they're going to remain on a delayed trajectory of development. That's okay. We can give them lots of supports that help maximize and ameliorate any issues that they may have. That's about 2% of the population, maybe 4%. Then we have a healthy trajectory. Thank goodness that is the vast majority of children, right? Perhaps they have some variation around a mean of normal development, what age you actually walk and what age you get your 2 words or your sentences, but it's generally a healthy trajectory. And that's about 85% of the population. And then there's an at-risk category. And it's that category that we want to make sure that the slings and arrows of life don't push those children that are at risk down into a delayed trajectory. We want to make sure that the things that we have push up those children back onto a healthy trajectory. And I think that that's where Help Me Grow's primary prevention really kicks in, is helping shift those trajectories, making sure the healthy stay on track, shifting the at risk up into healthy, and ensuring children with inherent issues that are delayed or disordered get the help they need. So it's really a cross-system thing. Go ahead, Rachel, next slide. And the next thing I want to offer, I'm also going to say, Rachel, have no mercy with me. If I start to speak too long, just tell me.
Don't worry.
The parents, as I mentioned before, are so key. And we know that there's 5 protective factors that help support healthy children. And Help Me Grow, again, across all 4 of our systems of all 4 affiliates here in New York State, work on each of these 5 protective factors, meaning that we increase parents' knowledge of child development. Developmentally appropriate expectations of parents is a protective factor. We help children in their development through screening so that they're on target. We help parents access concrete needs, concrete supports in the time of need. Sometimes that's a mom calling saying, I have 0 diapers left and I have a 2-year-old, I have no money, and I don't know how I'm going to make it through the next day. And that's helped me grow, being like, we're going to get you diapers. Because there's nothing more stressful than having a 2-year-old with a soggy diaper walking around. Everybody's irritable, right? So we're actually promoting child development by helping that mom out in that crisis. And then we're making sure that she gets linked to WIC, and then we're making sure she gets linked to SNAP if she's eligible, or the family's eligible. Okay, little tangent there. So concrete need support in the time of needs, parent knowledge of child development, resilience in the child, normal development in the child, parent resilience. What are we doing for parents to support them? Parents during the pandemic, especially parents of young children, took a big hit. They were incredibly stressed. They need our support now more than ever. And the last thing is isolation. There's nothing worse and that it gets back to the pandemic. There's nothing worse for young parents, or parents with young children, to feel isolated and be alone. So Help Me Grow addresses all 5 of those things. And as we work at it in our communities, we're building a healthier community. We're building New York citizens. Okay, now I'm going to switch gears. That's my big Help Me Grow New York State hat. And now I'm putting on my Long Island hat. And I'm going to tell you a little bit about what we're doing on Long Island. First of all, we've been in existence for 4 years. So we're entering our 5th. We have full implementation status from the national for an evidence-based model. Our centralized access point serves about 1,000 children per year, which is nothing given the actual population of Long Island. So we hope to expand that, but we know that we'll never reach every child on Long Island. We want to target those that are most needing our support. Importantly, with that work that we do connecting children and families with services, we have an 80% connection rate with an 85% retention rate, meaning that 85% of our families stick around long enough to tell us what happened. And oh, do they tell us what happened? Unique about Help Me Grow Long Island is about half of our referrals come from that health sector. It's because I am a pediatrician, we came out of that. And the other thing that's really unique is 3/4 of all the children we serve at Help Me Grow are under the age of 3. So we're catching them very early when families need this support. We work with over 35 childcare, home visiting, and pre-K partners across Long Island, with screening partners doing thousands of screens every year on children. And then one of the things we really learned from COVID-19 is that during time of needs, family turned away from worrying about whether their child was speaking on time to worrying about basic needs. Did they have money? Did they have food? The next slide shows the extent of our reach. Very important on Long Island that you include the whole of Long Island. So you'll see that the North Fork and the South Fork are on the bottom right-hand corner. And it just goes to show you that we're serving all of Long Island, but concentrating in areas of greatest need, like Westbury, Hempstead, Brentwood, Central Islip. Next slide. This gives you a little clue of who we serve on Long Island. We do serve a majority of Hispanic families, which a large percentage of Black families above the natural, the underlying population level. And that is a little bit because those families have difficult accessing the system. We're very specific of having bilingual staff across the board. Our staff speak both Spanish and Haitian Creole. We do not yet have a Chinese staff member, but that would, if we add another one, that would actually be who we add given the changing diversity of Long Island. And I think this is important pie chart to look at, because as many of you know, the birth generation, children that are being born in New York State, is now a majority minority population. And so it will be mainly children of color that are under 3. This is just a graph that shows you kind of the flow, and you'll notice that the orange graph is the one that had COVID-19 in the middle of it. That was the third dot that goes up into a triangle was March of 2020, and you see that we had a huge demand change from families during the pandemic. Go ahead, next slide. Just reinforces that the majority of the children that we see are under the age of 3. Next slide. And then this just shows you how families find out about us on Long Island. So we have a very strong relationship with our healthcare sector. And so this in 2021, that rebounded as children went back to well childcare. It had gone down during the pandemic. We get a lot of referrals from our community service agencies, signifying our strong partnerships within the community. And then, which we take as a huge compliment, is our third is friend and family, because there's nothing like telling your friend that you like the service and that was a useful thing. And it happened a lot during the pandemic, but still continues to this day. Next slide. Aha. So here's my last one, and I'm getting ready to pass it back off to Rachel, and I think we're going to move on to Onondaga next. But just to review that, the Help Me Grow, the model itself is an evidence-based, and it's communities leveraging what they have to support young children and their families. It builds on existing resources. And then specifically about Help Me Grow Long Island, we're excited to bring our partners together because we're strengthening families, we're promoting child development, and we're building a system that's accessible and equitable for all. Okay, there you go, Rachel.
Thank you so much, Liz. Thank you for such a great overview of Help Me Grow and what's happening across the state, and particularly all the impacts that you're making in Long Island. I'm going to invite Summer and our partners at Help Me Grow Onondaga to share next of the importance of investing in Help Me Grow at New York State, but also at the county level. So Summer, I will pass it to you and invite you to come off mute and share what's going on with you.
All right, thank you. Thank you. Good morning, everybody. Well, good afternoon, everybody. The lens of the Help Me Grow Onondaga presentation is to discuss how Help Me Grow is a win-win in our community, and we serve as a cornerstone initiative of the early childhood system building work in Onondaga County, and how the county partners benefits and invest in Help Me Grow. Secondary, how Help Me Grow meets the needs of the early childhood data system, and how data is crucial to the system building work that we're doing here in our community. Next slide. So this is just a quick overview of our Help Me Grow model. We launched in 2019, and we have 5 staff doing different functions of the Help Me Grow model. We have a staff that's dedicated to pediatric work, a staff for child care outreach, a staff for UPK outreach, and a staff for community outreach and support. Next slide. So Help Me Grow is a cornerstone initiative of the early childhood system building in Onondaga County. We have been incredibly fortunate to have our county human service team actively involved in bringing Help Me Grow to Onondaga County and helping with the planning and the implementation of our program. In addition, this is our county executive, and he has been pivotal in investing and sustaining Help Me Grow in Onondaga County. Next slide. As you can see from here, we have seen significant increase in our local state dollars in 2022. With our county budget, it was previously doing 60% of our funding, and with the passage of our county budget this month, it will actually increase to 80% funding of our Help Me Grow Help Me Grow model here. And the reason for the growth is in our county funding is because our county sees the impact that Help Me Grow is having on families in our community and helping those families navigate the fragmented early childhood system. Next slide. So why is the county investing in our Help Me Grow and seeing the significant investment in Onondaga County? So kind of like Dr. Isaacson said, we help support the 211 call line, helping to meet basic needs. We're also assisting parents with understanding how children develop and what milestones they should be reaching, while also providing a developmental screening and questionnaire for them. And with our limited data that we do have, we're helping to kind of build out that data system so we can have those system level conversation. Next slide. So in addition to the important role that Help Me Grow plays in supporting families and navigating the early childhood system and supports, in Onondaga County, it is a really incredible, important role to have the data that we need to support the families, but also collect around it so that we know what milestones children are reaching. The early child system, as we currently have it right now, we have very limited data. So it's important through the developmental screening that we do to gather more countywide data so that we can have some deepened conversations about where the understanding of children, how they're doing it and when it's happening. and how it's going in our county. And next slide. And so I'm kind of ending where I started. So we're fortunate to have this active county support and engagement with Help Me Grow. Leadership matters to the successful implementation of our model. And we hope that on the state level, we can build strong leadership as a cornerstone of the early childhood system initiatives in Onondaga County, and Help Me Grow can continue to serve in this early childhood initiative for New York State. And thank you.
Great. Thank you so much, Summer. And we have a great show of support for our attendees today from Onondaga County, Syracuse, and Central New York, who are all rooting and supporting this work. So thank you for sharing just a slice of impact that you're having, because truly you could have spent a whole hour talking about all of the impacts that you're making. So thank you for sharing that. And I'm going to invite our colleague from Rochester Finger Lakes, Kim Avery, to share a little bit about Get Ready to Grow as part of the Help Me Grow New York affiliates.
Thank you, Rachel, and thank you everyone for attending this afternoon. We're excited to share a bit more about Get Ready to Grow. We are a Help Me Grow affiliate for the Rochester, Monroe County, Finger Lakes area. And Get Ready to Grow is designed as a full, free, comprehensive screening, referral, and follow-up for each child to be developmentally on track and healthy. Next slide, please. We are really built as a community initiative, and this is just an example of the many partners that have worked with us from the beginning of Get Ready to Grow, building in medical partnerships, funding support, school districts, screening support. There are so many different avenues that support the work that we're doing to reach children from 12 to 60 months. Next slide, please. Our model is based on the full comprehensive screening, and the ages and stages questionnaires are such a key component of the information that we gather for each child. We make sure that the families understand the screenings are free and the follow-up support is available to them at no charge, building that relationship that Liz was mentioning early on of the family is the advocate for the child, and how can we help them to find the resources they need to be able to advocate. What we have found through our screenings is that at least 50% of children have at least one potential need identified. And I'm not going to read through the list, but you can see the areas that we do screen. And those ages and stages questionnaires really allow us to get a full picture of the child, because we know that the family is seeing behaviors and may have concerns that we are not going to see in those quick screenings. So it's a full comprehensive look. Next slide, please. Our community involvement does start with medical providers. We have system integration meetings, which are bringing in all of the disciplines in our partnerships. So our screenings may be done through a medical home, through our partnership with the local school districts. We go into child care centers. We are also taking, you can see a brief picture of it, our mobile screening unit, which we have to take out to locations where families may not be able to get to a screening. We are going to bring the screening opportunities to them. We also have some insurance reimbursement through Tier 1 CBO value-based payments, which helps to carry this project forward and helps us, again, to be able to connect with a variety of families. And then we had a large community awareness campaign in English and Spanish, making sure that our families would hear about GROW and be able to connect to the resources and learn more information and schedule their child for screenings. Next slide, please. This is some examples of the way that we share information with not only the families, which are the yellow cards that you can see. This goes home with the child on the day of the screening. When we are screening in childcare programs, the parents are not always there. So we want to make sure that they have that information, not only on the paper form, but on the far right on our family portal, which allows the family to be able to go in, review all of the screening results, complete those questionnaires. And they also have this information at their fingertips to be able to take back to their family doctor or to anyone else that they may have concerns and want to share this information with. The middle document that you see is a medical report. We send this to all of the medical doctors listed on the child's consent form to make sure that the doctor can also see all of the screenings that were completed and what those screening results were. So again, building that partnership with the medical home, with the family, and with the screening team. Next slide, please. This is an overview of the flow chart for Get Ready to Grow. The parents being the first piece, they are the most important. The community screening sites, our coordination, our screening teams themselves, the navigators who could be Get Ready to Grow staff, they may be childcare staff, they may be staff within the medical home. We know those relationships are so important. Someone that the family does not know, calling them to tell them there's a concern with their child can be very upsetting. But having that conversation with someone that you know and trust can make that process much easier. So the Get Ready to Grow model really builds on those current relationships and how can we make them stronger and make them more comfortable for the family as that follow-up continues. And then our data team, which, as everyone else has mentioned, the data is so important. It allows us to see where there's areas of need, where there's other areas we can improve upon, and where we can share out with others in the state what supports are needed. Next slide, please. This is just an overall population impact. We have done Get Ready to Grow since 2015. So these results carry us through June 30th of 2022, where we have screened over 7,000 children. Those children have received anywhere from 1 to 8 screenings, depending on the family completing those instruments, the screenings that we are doing with the children, or if the child is already receiving services in one of our screening areas, we will not continue to screen that child, knowing that they are connected already. Next slide, please. And if you could click it one more time, there we go. There is our mobile screening unit. So our mobile screening unit actually allows us to screen two children at a time. We can bring entire families onto the mobile screening unit. The friendly characters that you see carry throughout the motor vehicle through inside, so that the children feel safe, it's friendly, it's welcoming, and it allows us to conduct the screenings, meet with the families, help them with the supports, and then because of COVID, we actually have full sanitizing units throughout the system. We can sanitize the entire bus after each family leaves to help to make sure they understand that this is a safe environment, not only for the conversations we're having, but for their health and the safety of their children. Thank you.
Awesome. Thank you so much, Kim, and to the entire Get Ready to Grow team. You are a force, and truly having an innovative and comprehensive approach to this that undoubtedly is making some really significant impacts for young children and their families. So thank you for that. And I'm going to now invite our final Help Me Grow affiliate community, Western New York. And I'm going to ask Kim Stewart to unmute and share the awesome work that is underway in Western New York.
Hi, everybody. I am so excited to be here, and I get to talk about Help Me Grow Western New York, which covers 8 counties: Allegheny, Cattaraugus, Chautauqua, Erie, Genesee, Niagara, Orleans, and Wyoming. We are home to 100,000 plus children under the age of 5. And just to put it in, relatable terms, our region is the size of Connecticut, which is huge. And we are the first affiliate for Help Me Grow in New York State. So we're very proud of that. Help Me Grow's backbone agency is housed deep in the city of Buffalo, enabling us to get right to work in Erie County. In Erie County, we are engaging all Head Starts, many local districts, and we are involved in collective work with other organizations working towards the same goal of helping children and families. Our partners in Niagara County, home to the beautiful Niagara Falls, jumped right back into the Help Me Grow family and have screened children in Niagara Falls School District, along with Niagara Falls Head Start programs, setting families and children on the right track for meaningful learning experiences. And as I continue to share with you all that's been happening in Western New York, I just want to make an interesting note that all of this work has been done by this team in less than a year. This team is less than a year old, but their work is solid. For example, in the past 3 weeks alone, 300 children who are new to the Help Me Grow system have been screened. Okay, next slide. Making this happen started with the foundation of Help Me Grow. We started building our systems of support and did a lot of networking and a lot of listening. As a systems builder, Help Me Grow allows resources that have already been created to be utilized to their fullest potential particularly among individuals who might be least likely to access those services on their own. And this played a very important part as we entered into rural engagement, which is a different opportunity that we're really jumping into. So as we entered into some of our most rural places in the area, we approached these opportunities with humility and a sense of openness and curiosity. Rather than coming to the table with what we are going to do, we came ready to listen to what they wanted us to know. And as we mentioned, in Western New York region, we are covering what could be an entire state. So when we travel to one another, it's intentional and it's intense. I cannot stress how critical this is to have success and sustainability in these distant regions. This is taking time, but it's such an important piece of the work if we truly want to connect with all the areas to do collective work. We are just beginning this journey of rural outreach, but we believe that time is currency and that we need to invest. And we have been investing. We've invested our time and we've begun to develop social capital, inviting key stakeholders to the table and asking them, who else should be here? We've listened to what they were telling us, and we quickly realized how important Help Me Grow would be to support the good work already happening in these areas. See, Help Me Grow is an efficient system builders, and we have the ability to connect families and agencies to important resources that have already been created in their areas. For example, in Allegheny County, a strong partnership with Ardent Solutions and Allegheny County Early Childhood Development Coalition led to even more connections to expand our support and partnerships with trusted community leads. In Erie County, we've been working closely with Early Intervention, and they've adopted Help Me Grow as the local trusted resource for families that do not qualify for early intervention, even developing a one-pager to give to families. We believe that this will be shared with other early interventions from the other counties. We are running strong outreach and engagement with WIC in 4 rural counties, including an agreement to promote Help Me Grow with in-office marketing materials and Help Me Grow training for all WIC staff. And we have an incredibly active governance board with representatives from all counties, and we have hardworking subcommittees to advance this inclusive work. Next slide. As we talk about our campaign execution, our work in Wyoming County really influenced how we delivered our message. We met with the director of Wyoming County Office of the Aging and Youth Bureau, and Wyoming County Health Department Administration, or as we like to call them, Andrea and Laura. After the meeting, we knew that any campaign we had needed to be in partnership with trusted local community leaders. This was a very important lesson for us. We also learned that no 2 counties are alike and that each have their own culture and microcultures. Even how they get their news varies from Facebook to newspapers to digital apps and even their local radio stations. But it's our task to reach those families. And we've started materials. We have the standard materials here, as you can see on the screen. And the deliverables are magnets, poster versions, bookmarks, social media posts. And these rack cards are designed in 8 languages: English, Spanish, Vietnamese, Arabic, Burmese, Karen, Somali, and French. We also have a new texting feature, thanks to our partner in Liz in Long Island, to share with families over Western New York that shares parents' educational tips and family activities specific to their local areas. That is Bright by Text. But all of our work is led by the data, as we really like to talk about because it's so important. What we know, what we want to know, and are we having an impact? All is demonstrated through data. So I'm going to pass it over to Emily Oakes for just a moment because she is our expert in data collection.
Thank you so much, Kim. Good afternoon, everyone. So as previously highlighted, data collection and analysis is one of the 4 pillars of the Help Me Grow model. At Help Me Grow Western New York, we've designed a dashboard that can be publicly accessed on our website so that community members, partners, and legislators can see the state of early childhood screening in our region in real time. Since 2014, as you can see on the screen here, Help Me Grow Western New York and its partners have screened over 17,000 children. If all those children were provided a ticket to the Buffalo Sabres game, Keybank Center would nearly be full. So maybe this season folks would be kind of clamoring for those Bills tickets. So Help Me Grow's focus on data collection and analysis allows us to determine the return on our investments in an accurate and timely manner, and assess if we should make changes in our approach or advocacy efforts. For example, one of the tabs on our dashboard combines data about the level of childhood opportunity in a given zip code with our ASQ screening data. The Child Opportunity Index was developed at Brandeis University and is used across the country as a reliable indicator of early childhood experience for children in a given area. We've combined this data with the screening results of our Help Me Grow kiddos to get a better picture of what specific resources might be needed by Western New York children. I'm going to briefly highlight a tale of two zip codes here. So this is what you're looking at here is a rather dramatic difference that you can see between children who are living in Lewiston, they're on the left, and children who are living in 14206, a zip code of Buffalo, on the right. The 88% and 70% numbers that you're seeing here are actually is data from our ASQ SE2, so social emotional development screenings for these two areas. We've noticed this rather dramatic difference in the percentage of children who are on track that we've screened. However, the same differences are not necessarily reflected in other developmental screenings like the ASQ3. So this type of analysis is what we'd like to be able to perform for the entire 8-county area so that we can decide how we want to, what limited resources we have, we want to make sure that they're being invested in the right place. Also, we're looking to eventually combine this data with data from our centralized access point and regarding successful linkages and also gaps in care. This way we can efficiently and effectively advocate for the children in our region in the areas that matter most. Thank you, Kim.
All right, so I'm going to pass it off to Rachel for the next section.
All right, well, thank you all so very much. I am pleased to say that we have reached the end of our presentation. And I would just like to give a round of applause to our expert presenters and champions. Thank you so much for sharing all of the incredible work that is happening across the state. I want to now take a moment to invite a few questions. If there are questions, you're more than welcome to raise your hand. And as we collect questions, and I'll review the chat, and certainly I can also invite Risa, if there's who's been monitoring the chat as I've advancing the slides. So yes, we'll start right now. I'll ask you to unmute. Yes, sir. Please go ahead.
Hi there. I'm just wondering what the panel thinks the biggest obstacles are right now to expanding, increasing the bandwidth of all these programs.
Thank you. I will invite our panelists to respond. I see Liz is going off mute, but certainly, Liz, you can start, and then others can jump in.
Thanks so much for the great question. It's something we all struggle with. You know, we're 4 different entities. We're all funded somewhat differently. The funding that we received from New York State is helping us kind of come together and figure out a path forward. I do want to give a shout out to the Council for Children and Families in New York State, who's been an important partner in sort of bringing us together, helping us think about all of our data. But I think each of our regions are unique, and we definitely can't go further sort of without funding to enhance what we're doing locally. And interestingly, we do know that there's other communities across New York State that want to start their own Help Me Grows. So there's interest from 3 or 4 other communities that have come to all of us. Sometimes they call Lori Strano and Monroe, and then sometimes they call Rachel, and we all get together and would love to be able to help those other new communities come on board. And there is varied from rural North Country to, you know, urban, well, suburban, almost urban Westchester, who are also interested in this. Families have a really hard time navigating these systems, and that support for navigation doesn't fall under any one funding stream, doesn't exactly fall under education, doesn't fall under health. Even our health, some of our primary care clinics that have patient navigators, their patient navigators call us for kids under 5 because there's just this depth of knowledge. It's a unique population. So I think we are looking to strengthen all of our individual Help Me Grows across the 4 affiliates, and also looking to plan a way of expanding to new communities.
Are there enough staff to be able to handle a big increase? I mean, I know you can talk to anybody in any industry and, staffing's a problem. I just wonder how bad it is in your area.
Well, I can say personally, and then I'll let others speak. We're finally fully staffed. I've been looking for people for 6 months. So we are now fully staffed. I do think that there's potential. One of the unique things about Help Me Grow is it's not necessarily a new entity, but it leverages existing supports. And I think the story from Western New York showed that it's not necessarily a new staff member, but how can you work these partnerships more effectively and efficiently and share the knowledge across? But you're right, it's hard to hire everywhere.
Okay,
Thank you, Assemblyman, for the question and exploring further opportunities and how we can handle more robust support from New York and also the local experience. So thank you for that important question. Are there others that have raised their hand or other questions that did appear in the chat that we want to bring forward? I just want to offer that opportunity. I believe yes, go ahead.
No, Rachel, there's a question here from Brian. And he indicates, is there going to be any expansion in Finger Lakes like Steuben and Yates County?
I'm happy to take that one, Rachel,
Thanks,
if
Kim.
you'd like.
Yeah, thank you.
So yes, actually we have a partnership. So the Get Ready to Grow, it started in Monroe County. We are now expanding into the Finger Lakes region, and we have a partnership with ProAction of Steuben and Yates. They have screening teams that we have trained them. We support their navigation follow-up and provided all of the screening instruments so that they have the resources that they need. And we are continuing to work with them to expand into other areas of those counties. In addition, Livingston, Chemung, and Wayne County. And Wayne County is just now developing their screening team. Chemung has had an active screening team, so we've helped to expand the screenings that they're doing and the resources that they're using. And Livingston is where we are next knocking on the door as part of our funding requirements, but we're very excited to move into another county also.
Thank you, Kim. Thank you. We love the expansion. I want to just offer just a quick pause of ways we have a dynamic group of our partners in government and policymakers in today's program. We have a great group of our partners in philanthropy who are actively supporting Help Me Grow at the local levels. Lori Black just gave a big shout out. And so want to make sure that we're also shouting out our other friends in philanthropy. We have a lot of partners and champions that are part of today's call and other interested Help Me Grow communities. I see our friends from the Adirondack Birth to 3 initiative up in the North Country that have expressed interest. We have everyone across the state as part of today's call. So want to just share that. And so the ways that we can support, we're asking everyone today that we want you to join with us with Help Me Grow, with Liftoff of Western New York, and calling for investment in Help Me Grow even further in this upcoming state budget. We, as Assemblyman Hevesy had shared this in his remarks, we had a $200,000 investment that we are splitting among our 4 communities. And so we see a real opportunity to strengthen the work that we do and the reach of the work that we do with additional dollars from New York State. We are grateful for what we've received, and we see an opportunity to be even bigger, badder, and better as we look to the year ahead. Of course, we want to support our own Help Me Grow communities and local affiliates. So certainly being able to, with your time, with your treasure, and I will say, tooting the horn to keep with the T's, promoting, connecting, sharing of this great resource that is in the communities that we have highlighted today. And then, of course, the really easy lift is tell a friend, share a connection, Follow us on social media, promote. I don't want us to be the best kept secret in New York State for young children and our families. This is really, really important. You heard from all of our communities across the state of this incredible stuff that's happening. And children are thriving that are involved in Help Me Grow. And so we want to continue to make sure that we are addressing the needs of young children and their families and connecting them so well with Help Me Grow in Onondaga, in Long Island, in Monroe, and the Finger Lakes, and throughout the 8 counties of Western New York. So those are some 3 takeaways that we would love for you to have as part of today's program and ways to get engaged. So this is also the audience participation. You can follow us right now. You can pick up your phone and you can find us. So please be sure to do so. I'm going to invite any closing thoughts or remarks from our panelists before we leave for the day and go on to the rest of our afternoon. Any closing remarks from our colleagues, our Help Me Grow friends, Summer, Lori, Liz, Lori, Kim, we've got a bunch of Kims. So in the chat, or feel free now. But on behalf of the whole team, I say thank you. And any closing remarks, feel free to chime in. Otherwise, we will get on with the rest of our day. We have thumbs up. Thank you all for being with us today. Thank you for your comments in the chat and your emojis. Again, grateful for your support. And we will be getting you the slides, the archive of today's presentation, and some frequently asked questions so that you have those talking points that you'll need to be persuasive with our partners in Albany. So again, thank you. Have a marvelous day.